Imagine a nation where nearly every family has a story about addiction. A loved one, a friend, or a neighbor trapped in a cycle that drains lives and resources. This is not fiction. This is the United States today. Addiction affects over 20 million Americans annually, yet only a fraction receive the help they need. The issue is not just personal but profoundly societal, costing lives, fracturing communities, and burdening the economy. The time to act is now. According to the CDC, over 100,000 Americans died from drug overdoses in 2022 alone. That's an all time high. Nearly 21 Americans suffer from at least one substance use disorder, but only about 10% receive treatment. Addiction does not discriminate. Urban resource centers face opioid epidemics, and rural areas are battling methamphetamines and alcohol dependencies. All demographics, young, old, wealthy, poor, are affected. 1 in 8 children lives in a household with at least one parent battling substance abuse. This is a generational cycle of trauma. Addiction treatment and its consequences cost the U.S. over $600 billion annually, including emergency room visits, long-term health complication, and mental health crises. Approximately 65% of incarcerated individuals meet the criteria for a substance use disorder, costing billions in law enforcement and prison expenses. Guess what? Rehabilitation programs are far more cost-effective than incarceration. Addiction resources are everywhere. Plus, addiction reduces workplace productivity and contributes to absenteeism. This costs businesses about $81 billion annually. Rising crime rates and community destabilization are often linked to untreated addiction. Addiction is a disease, not a moral failure. Stigma prevents individuals from seeking help and perpetuates the suffering that it causes. Early intervention can prevent children from inheriting patterns of addiction, giving future generations a chance at a healthier life. Marginalized communities often lack access to treatment due to systematic inequalities. Addressing addiction is an act of social justice. Expand education programs in schools to teach about risks of substance abuse, not something like there, we need something better. Provide community support initiatives to address risk factors like poverty and trauma. Ensure addiction treatment is covered under all health and care insurance plans. Increase funding for public rehab access and centers and clinics. Create more sober living communities and peer support networks, not just ones that are run by the state, but privatized ones as well. Provide training for healthcare providers to identify and treat addiction compassionately. Shift from punitive measures to rehabilitation-focused approaches for nonviolent drug offenders. Implement proven harm reduction strategies like needle exchange programs and supervised injection sites if these people need it. Here's a call to action. Encourage grassroots organizations and governments to collaborate on tailored solutions. Demand policymakers prioritizing funding and reform for addiction treatment and prevention. And educate ourselves and others, dispelling myths to break stigma around addiction. Addiction is not an isolated issue. It is a national crisis demanding a collective action by addressing the problem at its roots. The United States can save lives, heal families, and rebuild communities. The cost of inaction is far too high far too high financially, socially, and morally. Together, we should ensure that recovery is not the exception but the rule, the norm. Let's take the first steps towards a healthier, more compassionate nation today. Also, I want to point out that we need to address the issue of glorifying addiction use in movies and in music. We can't have this anymore. Let's do something to fix this.